the community oncologist is using a lot of immunotherapy, right? I mean, they use it for many common cancers. And so it has to be, and I believe there is, more of a recognition of side effects. I think the general internist doesn't understand it. So I've had cases where patients show up in the emergency room and they don't know what's going on, and they get admitted, and then the patient reaches out to me and I say, oh, you have adrenal insufficiency, you need to do this, that, and the other. So I think it's not so much the oncologist. I think more and more oncologists are recognizing what these side effects, they look for them. It's mostly things like adrenal insufficiency, rashes, nephritis, hepatitis, and so forth. So as oncologists, maybe more than urologists, we tend to, even though you have new medications, we always tend to do the same thing, which is we check the blood test, we examine the patient. So there's if your creatinine is going up, you say, well, it could be immunotherapy. If your liver function is abnormal, it could be immunotherapy. Not used to be before, they'd say, oh, the patient must be regressing in the liver. Now we know that's not true. It could be drug induced. So I think we're, as a community, are getting better at it in treating, steroids. They have to understand there's a lot of publications, even seminars of how to taper steroids, et cetera, et cetera. But I think one of the areas where people don't understand is the non-oncologist, and when the patient shows up with the internist, in the emergency room. So if in terms of what the community oncologist should be telling his patient is, reach out to me. Something weird's going on, you're not so sure, you're feeling really fatigued, they could be hypothyroid. Maybe we didn't check your thyroid functions 2 months ago. It can happen can happen really quickly. And so I think they should make sure that they reach out to their oncologist and say there's an issue, because I do think in the community, other doctors who may be taking care of the patients really don't understand the side effects of these therapies.